Hey, what's up, guys? Welcome, 2025, Nurse California, back on the YouTube after several years. I want to hop on here and talk about the state of the whole nursing profession as of today. Just a super quick background. Today is January 2025. This June, it will be 20 years for me practicing as a registered nurse here in California. So I kind of know a little bit, just a little bit. I don't know too much. Maybe I do know a little more than most nurses that are starting out, but just want to talk about the state of the healthcare system, what it's like being a nurse in today's time. I often see new grad nurses in the emergency room that I work at right now. They have this happy phase. They're starting out their careers, which is good, which is really good. They're excited to start their career. They get to touch a few lives, save a few lives, lose a few lives. But they get to experience what it's like to take care of sick people here in America. And I honestly hope they don't lose that excitement. Although the way everything is going, it's really easy to get burnt out these days. Now, throughout the years, I've seen patients take advantage of the system, and I've also seen doctors take advantage of the same system. Now, I'm not saying it's a good thing or a bad thing. I mean, if there's a loophole, why not use it to your advantage? But I guess my problem is, I see patients, they don't pay for healthcare, they don't pay for insurance, and they use the emergency room basically as their primary care providers. Their their excuse is always, oh, it takes too long to get to my primary doctor, so I'm just gonna go use the emergency room, which is cool, especially if you don't have any copay and stuff like that. Yeah, it's cool. I like, hey, more power to you if you can do that, right? But what irritates me is you come in, right? You don't pay for healthcare. You don't have any copay. Government pays for you. Taxpayer money pays for your healthcare for your kids, yada, yada, yada. And then you come in and you want a Ritz-Carlton treatment. Bro, you can't expect a steak dinner with McDonald's money, okay? Like, we'll get to you, we'll see you, but if you start complaining about, I've been waiting too long, nobody's seen me. Look, I get it. You're using the system, so just, hey, that's what you got to deal with, right? If you're using the system to your advantage, don't complain about wait times. Don't complain about like it's taking too long to be seen, especially if you're not dying, right? If you're just coming in for like flu-like symptoms, where you could have just stayed at home, drink some water, get some rest, take some Tylenol, and just get better on your own. And then you come into the hospital complaining about not being seen early enough. Sorry, that, excuse me, that I don't like at all. Now, on the opposite side of the coin, I've seen doctors also who takes advantage of the same system. They know how to get around the system to maximize their reimbursements. And what annoys me about the doctors is some of them do this like super blatantly, right? They just do, okay? They know how to get around the system, which I don't care. Like, if you can do it, great, do it. But for the doctors out there, providers, if you're gonna take advantage of the system to maximize your reimbursement, at least do a good job, man. I've seen doctors try to take advantage of the system to maximize, their reimbursement, and they're just shitty doctors. That's super freaking annoying. Like, you get mad when we paid you, you throw in shitty orders, like when we ask you, all right, look, you got to admit this patient, whatever, and you just throw in some bullshit orders just to get them in. And, I'm like, all right, look, I get what you're trying to do, but at least take good care of the patient. I can think of one doctor in my mind. He understands the system. He knows how to get reimbursed, which most doctors and everybody knows how to get reimbursed. All right, it's how you stay in business. But there's one doctor, he maximizes what he can do to maximize these reimbursement. But at the same token, he's an awesome doctor. He's a good doctor. He takes good care of his patients. That, I don't care. Like, take as much from the system as you want as long as you're taking good care of the patients. He cares for the patients. When I need something from this doctor, he's like, yeah, sure, okay, I'm there. Gets there right away, knows what to do, boom, 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 get it done, addresses the problem, boom. While other doctors, they're just, I hate to say this, but they're just in it for the money. You know, they don't want to do the work, but they just want to get money. It's kind of sad because some of these patients they come in, they're like, oh, this is my doctor, Dr. XYZ, you know, he's really nice. He gives me his cell phone number. I can call him anytime you want. But as a nurse who's actually taking care of this patient, I'm like, yo, your doctor is a shitty ass doctor. Like, shitty doctor. He likes you, he's nice to you because you've got good insurance, right? Which is good. But I'm glad you have his cell phone number, because if he doesn't answer to me, you can just call him. I'll tell you to call your doctor straight up, because your doctor is being a little punk. But, and that's the system we work in, right? And as nurses, we're kind of just like paid employees. You clock in, you get paid for your hourly duties or whatever. And it's almost like being a nurse in 2025. Over the last 20 years I've been a nurse, I've just seen it kind of just slowly dwindling down. The quality of care is just going down. I remember when I first became a nurse 20 years ago, they used to never hire new grads into the emergency room, right? You'd have to start on the floor, work there for like 6 months, a year, or whatever, and you make your transfer down to the ER. But somewhere along the way, we started hiring new grads in the ER, which is not a bad thing, but it's a lot to learn. I've seen new grads who's done incredible ER nurse. Like, they were new grads in the ER and they went on to become incredible nurses. Incredible. But more often than not, I've seen new grads struggle. They can pass, but their quality of nursing is not that good. And I don't even blame them. I almost blame the system, because ER nursing is such a high turnaround. People come, people go, that they can't staff them, so they just start taking like new grad nurses, right? And hospitals, they don't want to train you for they don't want to train you for too long, because training you costs a lot of money. That's why some hospitals will have you sign a contract for like 2 years so they can get their investment back or whatever. But like the other day, I came into work 7 a.m, took over a patient from a night shift nurse, and this nurse was a new grad, less than a year in, you know, just got on her own, like just had recently just been on her own, which is cool, whatever. I took over an admitted patient. I come in, and then when I tell you it's a mess, I mean, you know, day shift always blames night shift blames day shift, whatever. It's always going to be like that. But when I look at her work, she missed so many things. The patient's a mess. The room's a mess. And then I can get frustrated at her, but it's not even her fault. As a new grad nurse in the ER, we train you to be an ER nurse. And then you become an ER nurse, right? And then all of a sudden they throw you like admitted patients, which floor nursing and ER nursing is completely different. The way we do things is just completely different. So now she's expected to work as a floor nurse while her other beds is an ER patient. And it's two completely different mindset. It's a two completely way of like managing care in the ER and on the floor. So unless you're comfortable with working the floor and working the ER, I mean, she's just not going to give good care to the patients. And then this is the thing about hospitals and our healthcare system. And this is an important point that I'm going to make here. Because quality patient care, high quality patient care, does not go together with maximizing profits. Let me say that again. High quality patient care does not go together with maximizing profit. As a matter of fact, they are inversely related to each other. The more you want to maximize profit, the less quality of patient care you're going to get. The higher the quality of patient care that you want, the less profits you're going to make. Let me explain. We always complain about, man, we're always short-staffed. Why can't we staff more? Like, you want quality patient care, overstaff your unit. That's just the way it is. Overstaff your unit. Overstaff them by like 1 or 2 nurses. All right? Where your nurses have help, we can give sufficient care at sufficient time, less mistakes. But are they going to do that? No. Why are we going to waste more money staffing nurses when you don't have to? That's just wasting money, right? Another thing, hospital food. If we really care about patient health, patient care, quality care, hospital food are shitty processed food. If we really care about nutrition, we'd serve like good quality, nutritious food. I mean, we give them sodas. I mean, there's literally freaking sodas and Jello and juices with high fructose corn syrup that we stock our fridge with, that we give to the patient. I mean, make it make sense, right? If we really care about quality of patient care, we'd at least start with that. Like, at least the food, make it nutritious, high quality, nutritious food that's not processed, not a lot of like chemicals. But obviously, it costs a lot of money. Hospitals are not going to go over that, right? Because they got to make profit. They got to make money too for the investors and all that stuff. And that's the thing. The hospital, as an organization, as a system, they want to maximize profit. And I can only speak about California, where I worked. But California, for you to get reimbursed, these patients, when they go home, they get like a survey at home where, you have to rate your hospital stay, whatever, like patient satisfaction score, right? It's got to be a 10, a 9 or a 10 or something like that to get reimbursed. So for the hospital to get reimbursed, the patient has to score them a 9 or a 10. Otherwise, they don't get reimbursed. So the hospital wants to make a lot of money. So they want to maximize money and quality of patient care, which is impossible. The only thing they can do is kind of keep this in balance, right? Maximize profit. Your profit's not going to be max. So if you maximize profit, your quality of patient care is going to be crap, right? And if you have really good quality of patient care, then then the profits is going to be like, unless you're like at some rich hospital in like, I don't know, Beverly Hills or something, right? Where they can pay. Then maybe you can maximize both profits and patient care, because they just have the money to pay. But your average hospital, they're going to try to maximize profits for the investors, the owners, and the company. Obviously, now where we have to come to the meeting point, I guess, to an agreement, is how do you keep this balance, right? So for the hospital to get reimbursed, the quality of patient care needs to be up there. But for the hospital to make the most profit, they cannot staff as much nurses as possible, or not even nurses, just even ancillary staff, you know. It's so wild to me that the hospital wants to maximize profits. That's their main goal, but they expect the workers to provide high quality patient care. So what happens? So we're always short staffed, right? Because they got to save money. Oh, it's not even within the budget. So now we're strapped, like as nurses, as the workers, as the frontline workers, or whatever you call it. Now we have to make do with what we have, with whatever they give us in our hands. We don't have a lot of staff yet. At the same time, we got to like make these patients happy, right? Patients are complaining, they wait too long, we don't have staff, we don't have a room. All right, cool. You know, if they really want to make increase, if the hospital really wants to make the quality of patient satisfaction really high, they're gonna have to spend a lot of money. That means the CEO, the investors, they're gonna have to take a cut in their profits and their paycheck and whatever. You know what I mean? But here's another thing too. For a hospital, healthy patients do not make them money. I mean, that's just how it is. They make money from sick people, right? So, I mean, most hospitals I work at or I've seen, they're not, very rarely will they tell you, they don't spend as much time promoting healthy living. I guess that's what I'm trying to say. They'll tell you, oh, you have high blood pressure, here, take this medicine, take that medication. You have diabetes, take this medication. And these medications are maintenance medication. It's not even medications to cure, right? It used to be medications, pharmaceuticals. It used to be like, you have an infection, oh, they came up with penicillin, it's an antibiotic. You take it for 7 days, boom, clear up, done. No more pills. You hurt something, you break a bone, go to the hospital, fix it, boom, you're done. Medication used to just be a short-term thing. But somewhere along the way, it became a long-term thing where you have to take medications every day for the rest of your life. To me, I don't like that concept because you're trying to fix a lifestyle with medication. Some diseases can only be treated with lifestyle changes. That's just the way it is, right? You're diabetic, high blood pressure, okay, change the way you eat, lose some weight. Those are lifestyle changes. It's hard. And nobody likes hard, right? Everybody wants to take a pill and fix their problem by taking a pill. That's just everybody. There's a pill for everything. It hurts, give me a pill, take away the pain. They don't look at what's causing the pain. They just give me the pill. It's like, oh my gosh, I've spent 20 years not exercising, eating like crap. Now I have high blood pressure. Give me a pill to fix it. It doesn't fix it, you just maintain it. But yeah, that's another thing too about hospitals. They don't really teach the patients, they don't focus on lifestyle changes. They'll tell you, hey man, you got to stop smoking, you got to start exercise, but that's it. It's probably, out of all the conversation a patient will have with staff in the hospital, it's probably less than 1 minute that they're going to talk about lifestyle changes. Less than 1 minute. They'll be in the hospital for like, whatever, 3, 4, 5 days in the hospital, and less than 1 minute is going to be spent talking about lifestyle changes. Maybe less than 10 minutes or 5 minutes. The rest of the time, it's like, all right, take this antibiotic, make sure you take your medications. But yeah, but that's just the system in America, right? It's that's the healthcare system in America. I'm not saying it's bad. But I'm not also saying it's good either. It's just the way it is. It's kind of like, if you're going to play a game of Monopoly, if you're losing in a game of Monopoly, you can't just be like, hey, I'm losing, I'm going to change the rules. No, you can't. You have to know the rules, how to play, and you've got to work within the confines of that rules to win. So I think as nurses, just know how this whole healthcare system is being played. Know how they're being, how they play the game, the rules, the laws, and then you just got to find out how to make it work for you. Over the years, I've seen nurses just complain about, we're short, we don't have any support, that it is and that. I mean, it's not like they can't hire more people. It's just not profitable for them to hire more people. But that's just the rules of the game. Because the game that the people are playing on top is to maximize profit, while we're over here getting paid to give quality care to the patients. But like I said before, if you're going to try to maximize profit, you can't maximize both profit and quality care. You just can't. You got to spend money to give quality care. And how much money is an institution willing to spend will determine the quality of care the patients are going to get. And that's just the way it is, right? So when I go in now, I'm an employee. I don't have any interest in making the hospital money. I don't have any interest in any of that. When I clock in, I'm there to do my job. I will give you the best, excellent care I can as a nurse. But when I'm clocked out, cool, I'm done. Don't ask me to do things that are like walking the lines between what's legal and what's not legal, just so the company, so the hospital can continue to function. That's not my job. My job as a nurse, I'm an employee. You pay me per hour, I'll give you an excellent job at what I do. But my job is not to make you guys money, although my job should help make the hospital money, but that's not my main focus. But that's just the rules of the game. So I make it work for me. So how, like in my own personal life, how do I make it work for me is, as a nurse, you're not going to win unless you're like an investor, an owner, or a part of the board in the hospital. You're not going to win. You're just going to make whatever you make per hour, per salary, whatever. That's what you're going to get. And then your job is to keep this machine rolling. So for nurses out there, for long time nurses, or if you choose to be a nurse for a long time, you just got to make it work for you. You got to do other things on the side, because if you depend too much on your hospital to take care of you, forget it. You just have to be responsible for yourself. Anyways, I've gone too much on a tangent. It's only the beginning of 2025. Happy New Year's. Hopefully I don't take another few years to come out with another video. Bye.